Welcome back to Practical Pediatrics for Parents. I'm Dr. Fernando Catalina. It's taken me a little bit to get this video out because I've had a bit of an accident and I've been busy with doctor's appointments and surgery, but I'm happy to be back on YouTube with this video about sleep recommendation for children. This is part 2 of a 3-part series on sleep. In part 1, I talked about sleep recommendations for infants. This video has sleep advice for children between ages 1 and 12, and part 3 is about sleep advice for teenagers. I'll start off with general advice about promoting healthy sleep, including sleep environment and routine, and then move on to common questions that parents ask me about their child's sleep, including the use of melatonin, sleeping in the same bed as the child, children who regress, bedwetting, snoring, nightmares, sleep terrors, and restless leg syndrome. If these videos help keep you and your family healthy, please like and subscribe. On average, toddlers between 1 and 2 years old need 11 to 14 hours of sleep per night. Preschoolers between 3 and 5 years old need 10 to 13 hours per night, and school-aged children between 6 and 12 need 9 to 12 hours of sleep per night. To help your child be a good sleeper, you should provide a good sleep environment and you should have a consistent bedtime routine. You should try to make your child's bedroom as soothing as possible, turning off overhead lights and keeping the room mostly dark. It's okay to use a nightlight, and if your child is scared of the shadows that the nightlight makes, consider having 2 nightlights on different walls, which should reduce the amount of shadows and hopefully be less frightening. Normal household sounds are okay, but try to avoid loud noises that could keep your child up at night. You should keep the room a comfortable temperature, somewhere between 68 and 72 degrees Fahrenheit. 1 hour before bedtime, you should turn off all electronics, including television, video games, tablets, cell phones, and computers. Getting exercise during the day is a great idea, but you should avoid vigorous or strenuous exercise in the hour before bedtime. Don't give your child drinks with caffeine. This includes soda, energy drinks, coffee, and some teas. If your child takes naps, you should limit naps to early afternoon. Naps that happen later in the day will interfere with putting your child to bed in the evening. You should avoid big meals right before bed, but a light snack is okay. As much as possible, you should try to keep a regular schedule, putting your child to bed and waking them up at around the same time every day. Try to have a consistent bedtime routine. For example, the child could take a bath or a shower, brush their teeth, put on their pajamas, get in bed, and read a book. For younger children, it's a wonderful bonding experience for parents to read books to their children as part of the bedtime routine. For older children, they could read to themselves, or they could read out loud to you, or you could alternate, where you read a page and they read a page, so that it's something you do together. After your routine, turn off the lights and leave the room. Having a good sleep environment and a consistent bedtime routine is enough to help most children be good sleepers. What follows are my answers to the most common questions that parents ask me related to sleep.
Can I give my daughter melatonin?
Melatonin is a hormone produced in the brain that helps you fall asleep. It does not keep you asleep. It's generally safe to use melatonin in children, but the American Academy of Pediatrics does not recommend prolonged use of melatonin. Before you give your child melatonin, you should talk to your pediatrician to see if it's safe and recommended for your child. If they recommend using melatonin, you should start with a low dose, such as 1 or 2 milligrams, and give it at the same time every evening, making it part of your bedtime routine. If that dose does not work, ask your pediatrician what's the maximum dose for your child, and you can slowly increase the dose until you reach an effective dose or you hit the maximum. If melatonin has been working, your child has been sleeping well, after 2 to 3 weeks, stop giving the melatonin to see if the sleep routine has been established and they're able to sleep without taking melatonin.
What do I do if my child will only fall asleep if I lay down with them?
Children feel comforted when they're with their parents. But if they learn to fall asleep when their parent is present, they will likely need the parent to be there during the night when their sleep cycle goes into the light sleep phase. You can wean your child off of needing you to be with them by the following method. After the bedtime routine, sit down in a chair near their bed, but not in the bed with them, and let them know that you're there and comfort them if needed. Do this until they fall asleep. After a few nights, move the chair away from their bed, over by the door to their room, letting them know that you're still there and comfort them if needed. Once they've gotten used to falling asleep with you sitting in the chair that's farther from their bed, let them know that you're moving the chair outside of their room, but you'll still be there if they need you. If they call you, you can look in and let them know you're there, but stay outside the room. After a few nights of this, they should be able to fall asleep without you having to be in the bed, in the chair, or near their room.
My child was a great sleeper, but now they wake during the night and have trouble going back to sleep.
Sometimes children that were great sleepers regress and go back to not being good sleepers and needing their parents to be with them. This often happens because of an illness, where the parent didn't want to leave their sick child alone all night, so they brought them into the parent's bed or they lay down with the child in the child's bed. Unfortunately, good habits take a long time and work to get established, but bad habits seem to get established very quickly. As soon as possible, try to reestablish the good bedtime routine that had worked previously, and if necessary, use the method I outlined earlier to wean the child off of being in bed with their parent.
My 6-year-old son still wets the bed. What should I do?
85% of 5-year-old children are able to stay dry at night, but that means that 15%, or about 1 out of 7 kids, are still wetting the bed when they're 5 years old, and this is considered normal. The percentage of kids who stay dry at night slowly increases as they get older, and by 8 years of age, about 93% of children are able to stay dry, although some children will continue to wet the bed until their teen years. If your child is potty trained during the day but having accidents at night, you can try using a bedwetting alarm, together with a positive reward system to help them stay dry at night. Make sure to address any constipation issues, as this can also cause urinary symptoms. If your child is 8 years old and still having trouble wetting the bed, consult with your pediatrician. This may require further evaluation. Also, you should consult your pediatrician if a child of any age was dry at night for over a month and then starts wetting the bed again. If wetting the bed is causing social distress for your child and keeps them from participating in sleepovers, talk to your pediatrician. There is a medication that we can give that will help your child stay dry on a short-term basis and is safe to use for a few nights.
I hear my son snore at night. Should I worry?
Many people snore, and it's generally not medically concerning. However, if you hear your child snoring and they're also having episodes of struggling to breathe, this could be something called obstructive sleep apnea. Take a video of your child while they're sleeping and show it to your pediatrician. This will help them determine if their snoring requires further evaluation.
What should I do about my daughter's nightmares?
Nightmares are scary or upsetting dreams that can sometimes wake a child up. If your child has a nightmare, reassure them that nightmares are not real, that they're just dreams, and that the nightmare will not hurt them. Nightmares are normal, but you can reduce the chance of your child having nightmares by providing a safe, comfortable environment and having your child sleep with a favorite toy, stuffed animal, and use a nightlight. You should avoid having the child watch scary movies, scary TV shows, or reading scary stories.
My child sometimes wakes up screaming, and there is nothing I can do to calm them. It's like they can't even tell I'm there.
Sleep terrors, also called night terrors, are common, happening in up to 6% of children under 12 years old. They're most common in kids between 5 and 7 years old. Usually, 2 to 3 hours after they fall asleep, the child will sit up in bed screaming, or lay in bed thrashing around, or some kids will even get out of bed and walk around. They don't seem aware that you're there, and it's impossible to comfort them. Night terrors usually last about 5 to 10 minutes, and eventually the child goes back to sleep. They won't remember the night terror when they wake up in the morning. Sleep terrors or night terrors are alarming for parents to see, but they're not medically concerning, and most kids grow out of them. If your child is having a night terror, don't try to wake them. You should sit quietly near them, keeping them from hurting themselves, from thrashing around or walking around, and wait patiently until they go back to sleep. You should consult your pediatrician if your child has night terrors that last for longer than 30 minutes, or if they're happening more than once a week.
My child is a restless sleeper and kicks a lot. Is this normal?
Up to 4% of children have restless leg syndrome, a condition that causes an uncomfortable urge to move the legs. It typically happens in the evening or nighttime hours and can disrupt sleep. Restless leg syndrome can be caused by low iron stores, and if so, it gets better with iron supplementation. Talk to your doctor if you think your child may have restless leg syndrome. They will likely order a blood test to determine if your child needs iron supplementation. I hope you found this video helpful and that it helps your child be a better sleeper. If you've tried the things I suggested here and sleep remains a challenge for your child, talk to your pediatrician. That's what we're here for.